Good morning. My name is Dr. Kimberly Citron, and I am with Connecticut Behavioral Health in Cheshire, Connecticut. Today we'll be discussing trauma-informed educational practices and how to implement them in an academic setting. The topics we'll be discussing will be useful for teachers as well as support staff, behavior technicians, paraprofessionals, as well as administrators and school counselors. The first aspect of trauma-informed educational practices we'll be discussing is how to modify your infrastructure or make environmental changes in accordance with trauma-informed care. First, we'll be discussing your classroom setup. Next, we'll be discussing how to create and utilize emotional toolboxes with your students. And finally, we'll be discussing the importance of staff and program consistency. With regard to your classroom setup, be sure that your classrooms are set up in such a way that all emotional or behavioral management tools are accessible, child-friendly, and easy to utilize. So for instance, if you're utilizing the zones of regulation curriculum, you want to make sure that all of your signage is at eye level for children so that they're easily able to see and access information that they may prompt them to use their social and emotional communication skills. Attention should be called to all relevant signage daily for the first 8 weeks of school. This can be made into a game using something like I Spy and saying, I spy my emotional tools for feelings of sadness and having the children locate them throughout the classroom. It could also be turned into a game using an emotional scavenger hunt and having children find one or two skills for each of the zones of regulation. So whether they're feeling sad or angry or worried, you can encourage them to find the emotional tools for those feelings around their classroom. And we want to ensure that children are prompted to utilize these skills by the adults. And really, for the first 8 weeks in any new academic environment, we should be calling attention to these prompts, these visual prompts that are displayed on a daily basis for the children. If there is a check-in about how you're feeling sign that's posted near the door, you want to make sure that children actually are using that every day and checking in and placing the appropriate, in the zones of regulation, it would be placing the appropriate color next to their name to describe how they're feeling. And we just want to make sure that those are constantly utilized so that they don't become stale or underutilized, because they're important tools for our students. Creating our emotional toolboxes for students can be a ton of fun. So we want to make sure that there is an emotional toolbox at every level of emotional functioning. So again, working off the zones of regulation, we want a toolbox, a green toolbox, if you will, a yellow one, a red one, and a blue one. So the green one, of course, is we want children who are functioning well to be able to access emotional tools just as if they were having some difficulty in feeling angry or sad. We certainly don't want to imply that when children are doing well, that they won't have access to an emotional toolbox, because that would only serve to reinforce feeling angry or sad or worried, because it would be the only way that kids could gain access to these toolboxes. So in the green toolbox, you want things like a relatively simple pencil grip, perhaps some putty, maybe one generalized calming card with some coping skills such as counting backwards, or singing a positive song in your mind, a picture plan for some activities that the child may be engaging in throughout the day. And they do make stretchy rings that children can stretch out and pull upon. At the yellow level, we want to increase the activity level that the child can engage in, because clearly the child at that point would be experiencing some emotional distress. So we might include something like color changing putty, coping cards for when you're feeling frustrated, perhaps a stress ball. Kaleidoscopes work really well at this level because the child or adolescent can become distracted looking at the color or how the color changes. That tends to increase the cognitive load that's required for utilizing the toolbox, which is something that we want. We want the cognitive load to increase at every level, because when a child is in the red zone, they will require more distraction and redirection than perhaps a child in the yellow zone would. So at the red zone, we would include coping cards for anger. If you have a sensory room in your program, you would include an access card for the sensory room, a card for taking a walk or listening to music. You may include a small container of water beads at this level, a pinwheel so the child can exert some frustration by blowing the pinwheel and watching it move. Tissue paper to perhaps rip up if a child is feeling destructive. It may be helpful to have something that they are actually allowed to tear up or destroy, if you will. Bubbles, blowing bubbles can often calm children down. So bubbles come in very small containers that are good for this type of a toolbox. A maze or puzzle book, something that the child, an activity that the child may be able to engage in. These also come in miniature form that we will be able to fit into our toolbox. And perhaps some scratch and sniff stickers, which require the use of our sensations. And again, with each level of these toolboxes, we want to increase the sensory aspects of the toolbox. So being able to see something, perhaps hear something, smell something with the scratch and sniff stickers. At this level, you could put in pencil grips that have a higher sensory component. So they do make the pencil grips that are kind of like a squishy ball that go on the pencil. So you would want something like that. And then at the blue level, you would want to include, again, some techniques for distracting the child. So perhaps a kaleidoscope. So again, they could look at the different colors changing. You might want to include something for coloring, some positive affirmation cards, coping cards for sadness. And again, we know that children in any mood often enjoy the use of putty. So before we move on to our next segment, I just want to let you know that you can utilize a basic pencil box, a plastic container. They're relatively inexpensive for these emotional toolkits. And then you can either add colored stickers to color code them, or if you needed to, you could even just color in a circle at the top of the box with a colored Sharpie or something of that nature. So we will next be moving on to stage 2 of trauma-informed educational practices and discussing validation. But first, we will take a short break. Thanks so much. Before we move on to discussing validation, we are just going to briefly cover the importance of staff and program consistency in providing trauma-informed educational practices. It's very crucial that staff within a program apply consistent application of rules and the use of emotional tools for students in a trauma-informed program. We want the consistent application of rules, privileges, and reinforcers, including things like hugs, high fives, fist bumps, things like that. We do not want variation, or at least we want limited variation between staff, between teacher and staff, or from child to child within the same staff member. So we want to make sure that we are treating children equitably and that they all have the same access to reinforcers such as attention, praise, use of their emotional toolkits, access to a sensory room if you have one, and things of that nature. I'd like to make a note that this is not inconsistent with the individualized approach that we will be discussing later as an aspect of trauma-informed educational practices. As we know, children's coping skills can be individualized, our understanding of them is individualized, Specific prompts that we may use can be tailored to a specific child or adolescent, but we want to ensure that the application of rules, privileges, and reinforcers remain as consistent as possible. I'd also like to take a moment to discuss resource development, or the development of resources within your program that can be shared at either an age-appropriate level with students themselves, or that can be shared with parents to provide psychoeducation regarding trauma. So we want to provide families and students with resources regarding trauma, what types of trauma exposure exist, the impact of trauma on children and adolescents, and treatment options that are available to them. The Child Traumatic Stress Network is an excellent resource for information sheets that you can print off for parents. And I would suggest that each teacher within the program develop their own resources and then share them among teachers and staff, and just make sure that you're not duplicating your efforts. Moving on to stage 2 of trauma-informed educational practices. Validation is the next stage that we'll be discussing. Providing validation is allowing the child recognition of his or her current emotional state. We want to provide validation for children and adolescents' feelings. When providing validation, we want to avoid asking for further explanation, making an invalidating statement, or challenging the child's beliefs. So for instance, often with the best of intentions, if a child says, "I'm sad because I forgot my lunchbox," we might say, "Oh, that's no big deal," or "I bet you lots of other people forgot their lunchboxes today." But that sort of fails to acknowledge the child's current emotional state of being sad that he or she has left their own lunchbox behind for the day. So we don't want to make an invalidating statement that suggests that this is not something to feel sad about, because a child or adolescent is entitled to his or her emotions. But of course, we want to help them cope with those emotions, and providing validation is the first step in that coping process. Because in order to cope with a negative emotion as human beings, we often want to feel that we have been heard, or that someone has seen or recognized our current emotional state. So for instance, if a child is upset that they are not being picked up early from school, we might say something like, "I understand that you're upset that you're not going home early today." Or if they're upset that they don't have the lunch that they may have preferred, we might want to say, "I know it's frustrating when we don't have what we'd like to eat." And that would provide the child or adolescent with validation around that emotional state. Providing validation does not imply that you are endorsing a child's feelings or possible negative behaviors that may have already occurred at this point in your interaction with the child. It does not mean that you are endorsing those behaviors as appropriate or justified. It simply means that you are acknowledging the emotions that the child is experiencing at the time and providing validation for those emotions. Stage 3 of trauma-informed educational practices involves active listening. Active listening includes providing the child with ongoing feedback regarding what you are hearing them say. So it's kind of like the next step after validation. You want to be an active participant in the conversation with a child or adolescent. You want to avoid distraction, and you want to provide them with ongoing feedback. So we are going to kind of take a deep dive into what those steps of active listening are. So first, you want to ensure that you are paying attention. You want to pay attention to the child or adolescent with whom you're interacting. You want to show them that you are listening, and we'll discuss different ways for doing so. You want to provide them with feedback regarding the conversation. It's important that we defer judgment and that we respond appropriately. So let's take a look at what paying attention entails. You want to give the speaker your undivided attention and acknowledge the message that they're sending. You want to recognize that nonverbal communication also speaks loudly or sends messages to the person with whom you're interacting. You want to look at the speaker directly Try to put aside any distracting thoughts that you may be having. It's very important that we not mentally prepare a rebuttal. So it's a human tendency that when someone's speaking to us, or perhaps making an argument or trying to convince us of something, that we begin mentally preparing our response before the person has actually finished speaking. So it's very important in trauma-informed educational practices to avoid doing so. This is actually not a trauma-informed way of communicating with someone. And of course, you want to try to avoid being distracted by environmental factors, which I know can be very, very difficult in a busy classroom where you're meeting the demands of multiple children at a time. But we want to do our best to interact with the child with whom we're having a conversation by providing them with eye contact and trying to avoid being distracted by whatever else may be going on in the room. The next step for active listening is to show that you are listening. And there are several ways that we could do this. You use your own body language and gestures to show that you're engaged. So you want to nod occasionally, you want to smile and use other facial expressions. You want to make sure that your posture is open and interested. So this is where we would avoid the crossing of our arms and sending messages that we're actually not interested in what someone is saying. And you want to encourage the speaker to continue with small verbal comments like, yes, I understand, things of that sort. The next step for active listening is to provide feedback to your interaction partner. So our personal filters, assumptions, judgments, and beliefs can sometimes distort what we're hearing. And as a listener, it's our role to understand what's being said by our partner in the interaction. This may require us to reflect on what's being said and to ask questions. So you might want to reflect on what's being said and paraphrase by making a statement such as, what I'm hearing is that you're frustrated because your classmate took your pencil. And sounds like you're saying that you're really sad because your mom forgot to put your lunchbox in your backpack. So these are great ways to reflect back what a child or adolescent might be telling us about how they're feeling. You want to ask questions to clarify certain points. So you might begin by saying, what do you mean when you say that you're angry because your whole day is ruined, if a child said something like that? Or you might want to say, what I'm hearing is that you're frustrated because we're not going outside for recess. Is that what you're trying to tell me? And you want to summarize the speaker's comments periodically in this manner. The next step for active listening is to defer judgment until your communication partner has finished communicating what they would like to communicate to you. So interrupting is a waste of time. That does not lead to effective communication. It tends to frustrate the speaker and can also limit our full understanding of the message. So you want to allow the speaker to finish each point before you ask questions. You want to look for that organic, natural pause in the conversation. And do not interrupt with counter arguments. Finally, we want to respond appropriately. Active listening is designed to encourage respect and understanding between communication partners. So you're gaining information and perspective throughout this entire communication. There's really nothing that can be added or gained by attacking the speaker or otherwise putting the student down. You want to be candid, open, and honest in your response and assert your opinions respectfully and kindly. In other words, we want to treat our communication partner in the manner in which we would like to be treated. So that concludes our steps for active listening. And at this point, we will take a break and we'll be back shortly. Thanks so much. Welcome back, everyone. Now we are going to cover stage 4 in provision of trauma-informed educational practices, reflection. In a reflective classroom, teachers and staff encourage their students to create meaning from their experiences in both oral and written form. Teachers invite students to reflect on various things throughout the day. So, for instance, reflecting on what they've learned in a given lesson, reflecting on intended versus actual outcomes. So, again, if we see a child trying to clean up colored pencils and they accidentally knock all of the colored pencils on the floor, we would model reflection by saying to the child, I see you were trying to clean up those pencils and then they all knocked on the floor by accident, and kind of reflecting on the fact that you acknowledge that the child's intention was different from the actual outcome. Reflecting on evaluating their metacognitive strategies. So thinking about thinking when we see children kind of noticing that they may have figured something out by perhaps they figured out a math problem by counting the colored pencils on their desk or placing them into groups for multiplication. You would want to model again for the child how to reflect upon that. Like, gee, I see you were struggling with that math problem. And then you had the idea to put the colored pencils into 3 groups of 2, and that helped you to figure out that there were 6 colored pencils, and so on and so forth. Just reflecting for the child or adolescent about their use of metacognitive strategies. Reflecting on how to analyze things and draw inferences about causal relationships. So even reflecting on, I saw you got really angry and you kicked that chair, which it looks like that kick that caused the chair to turn over and fall on the floor. Just reflecting on what we observe in our daily interactions and as a result of our behaviors and the children's behaviors. And of course, reflecting on how they apply their learning to new or novel situations. So when you see a child applying their knowledge of perhaps math skills to figure out how many people will be on each team for a particular activity, you want to reflect on, well, gee, you were able to say that there were 10 students, and if we needed 2 groups, there would be 5 students in each of those groups. So reflecting on how the child was able to use strategies that they learned in mathematics for creating groups of their peers. The next stage, stage 5, involves a focus on resilience and protective factors. So resilience, we know, is the process of adapting well in the face of adversity, trauma, tragedy, or threats or sources of stress. So this can include family relationship problems, health problems, problems in the educational setting, financial stressors. Resilience really refers to bouncing back from difficult experiences and is obviously quite relevant to many children's current circumstances. Protective factors refer to conditions or attributes in individuals, families, or communities, or the larger society that help people to deal more effectively with adversity or adverse circumstances and mitigate or eliminate the risk in families or communities that are impacted by trauma. So protective factors can really help us to promote resilience among students and families that we work with. Teachers and staff should make every effort to identify instances in which students, teachers, or staff demonstrate resilience. And again, we combine the previously learned skill of reflection, and it would be beneficial to reflect when you see resilience manifesting itself in the classroom. So if a child perhaps came to school in shorts on a particularly cold day, we might want to note how the child demonstrated resilience by still going out at recess and staying extra active so that they could stay warm and so on and so forth. Or if a child is hungry early in the day, but perhaps after snack time, and they're able to work through it and make it to lunchtime while still attending to their work, we'll want to acknowledge that and say, gee, I noticed how resilient you were in that you were hungry a short time after snack time. However, you were able to focus and engage in your work for, the time being until lunchtime. Teachers and staff should also identify and cultivate protective factors for each individual student and rely upon them in the course of any given day, week, month, or year. So for some students, humor is an excellent coping skill, and that can be a protective factor that the child is able to use humor as a coping mechanism. So you would want to build that into their programming. For another child, a tendency to be caring and kind and wanting to be helpful can be a protective factor. So you would want to cultivate that perhaps by giving the child some exciting chores or tasks that they might be able to assist teachers and staff with, really giving them a sense of empowerment and using that protective factor of being a kind, caring individual to promote resilience in that individual child. Stage 6 involves the use of positive reinforcement. So positive reinforcement involves the addition of a reinforcing stimulus following a behavior that makes it more likely that that behavior will occur again in the future. So when a favorable outcome, event, or reward occurs after an action, that particular response or behavior will be strengthened. So positive reinforcement can come in the form of praise or acknowledgement. It can come in the form of implementing a particular privilege. So again, for kids who enjoy helping, that might be being able to assist the teacher with implementing a particular lesson, or perhaps going on an exciting errand with a staff member. And so what we're encouraging is that teachers and staff take steps to identify positive reinforcers that are rewarding to specific children. So again, pulling in if you have a sensory room in your program or just the use of sensory tools, certain children will find that much more rewarding than other children might. And you want to use that as a reinforcer to promote positive behavior. Certain students might find activities such as coloring to be a positive reinforcer. So we would want to give access to art supplies following a positive behavior. We know that many students are reinforced by use of electronics or a Chromebook in the classroom. So that's often used as a positive reinforcer or reward for good behavior. We want to ensure that teachers and staff are initially providing positive reinforcement immediately following a behavior. So positive reinforcement should be fairly immediate, as soon after the positive behavior has occurred as possible. In the beginning, particularly if positive behavior is not happening frequently, then you want to reinforce it every time that it occurs. However, once the positive behavior is well established, you want to fade out the use of the reinforcer so that you're not reinforcing every time, but rather you're reinforcing on a particular ratio, say every 3 times the positive behavior occurs, or based on a time interval. So if the positive behavior is occurring over a period of time, like 30 minutes, you would want to provide the positive reinforcer such as praise, or perhaps access to 3 or 5 minutes of coloring in a particular on a particular coloring page, or something that the child finds rewarding. Stage 7 involves providing an individualized approach to trauma-informed educational practices. So this refers to a method of teaching that tailors content, instructional technology, and pace to the abilities and interests of each individual learner. So in some programs, this is built in, and there are more staff and behavior technicians available to implement individualized learning practices. And in other programs, it can be somewhat more challenging. However, we want to ensure that we're building in individualized approaches as much as possible. So social emotional learning as well as classroom instruction should utilize an individualized approach whenever possible. So this can include the personalization of emotional tools. Coping cards can be tailored to a specific child. So if a child happens to like Paw Patrol, you might want to include Paw Patrol stickers or something of that nature on their cards. If a child or adolescent likes Marvel superheroes, you might be able to personalize their cards utilizing some of those characters. Teachers and staff should identify the needs of each student in terms of how they might be able to acquire a social, emotional, or academic skill. So we really want to do kind of a needs assessment in terms of what will be most likely to resonate with this particular child. And are they better equipped to learn verbally through oral instruction, or do they need a visual guide and written instructions? So really tailoring it to the student's individual skill set and needs. Teachers and staff should tailor a lesson in social, emotional, or academic skill acquisition to the needs and interests of each student. So for instance, a child who enjoys reading or storytelling may benefit from a social story. An artistic child may benefit from some artistic expression of the skill to be acquired, and a child who enjoys music may benefit from making up a song. Stage 8 focuses on a strengths-based approach to the provision of trauma-informed educational practices and is closely linked to the provision of an individualized approach. The strengths-based approach is focused on finding the positive attributes of a person or group rather than the negative. And this could be applied to our staff, our teachers, our students, and ourselves. There are many ways in which a strengths-based approach can be applied. For instance, it can be applied in leadership, counseling, community and social work, pediatrics, and of course, in an educational setting. Teachers and staff, I know you guys all constantly do this, you identify each of your students' individual strengths. So again, some students may be particularly kind or caring. Some may be very organized. Some may be very loquacious. They may be very verbal and talk a lot and like engaging other people in conversation. Some might be artistic or athletic. And we want to capitalize on all of these strengths and really cultivate leadership in the specific areas in which individual children and adolescents exhibit strength. And again, this works with teachers and staff as well. So some of you might really enjoy developing some of the coping cards for students to use. You might be artistic yourselves or just enjoy creating visual tools for kids to use. I would recommend that you partner up with someone who might have another strength in an area in which you are less adept and capitalize off of one another's skills. Teach one another, assist one another in developing the tools that you need for your classroom and for working with individual students. I would also, encourage teachers and staff to integrate each student's strengths into their, social and emotional curriculums. So for instance, strengths can be built into anything that we are trying to teach a particular child or adolescent, whether that's an academic skill or an emotional skill. So we want to make sure that for that athlete, we might use some sports analogies. For instance, I had my humble beginnings in inpatient residential treatment for adolescents, and I worked with a young student who was very averse to therapy and did not want to engage in any form of talk therapy or cognitive behavioral therapy with me. And so wanting to make this work and knowing that this student was very, very skilled in basketball, I transitioned my sessions into the gymnasium, and I asked this youth if he would be willing to teach me to play basketball. And after a few sessions in which I allowed him to instruct me on skills, in the game, we were then able to create all of these fantastic analogies for anger and basketball. So for instance, when you overpower the shot, when you throw the ball too hard and it goes behind the backboard, we were able to create analogies for how sometimes we overpower the shot in our expression of anger, and the adolescent each week was able to come up with examples of how he may have overpowered the shot in his communication with others. So whether you have a young athlete, a young artist, or someone who's particularly kind and caring or organized, you want to build that strength into everything that you're trying to teach that particular student, whether it's a social and emotional skill such as coping with anger, or an academic skill such as learning multiplication or division, or memorizing the names of the presidents. Next, we will be moving on to stage 9, which involves peer modeling. But before that, we are going to take a quick break, and I will be with you shortly. Welcome back, everyone. Now we will be discussing stage 9 in the provision of trauma-informed educational practices, peer modeling. Peer modeling provides children with the opportunity to learn social skills from typically developing peers through games and activities. Lessons are designed so that children learn while they play and observe the proper behavior of others. So this can take place within your own classroom when we see children and adolescents engaging in appropriate pro-social behavior and are academically on task. Teachers and staff utilize a strengths-based approach to determine appropriate peer models for specific behaviors. So if you have tables in your classroom, you may want to pair up children based on their particular level of skill. And so a child who may be slightly more behaviorally or emotionally dysregulated should be paired with a child who has a little more stability at that particular time and who may be doing well in terms of staying focused on tasks or utilizing emotional coping skills or the emotional toolboxes. And the idea here is kind of based on passive learning, and that, children are very observant creatures and they are constantly watching us and one another. And so they are often passively learning from one another, and we want to set up the ideal circumstances for that to occur. So you want to pair students with appropriate peer models and to guide students in peer modeling of specific skills. And we also do this by modeling for one another. For instance, modeling your learning of these trauma-informed educational practices for one another. So there might be one team member who feels particularly strong in the area of active listening, and there might be another staff member who feels as though this is a challenge, and they're kind of able to self-reflect and see that they often interrupt the students when they're explaining their positions. And so those two staff members may want to work together for a period of time so that the staff member who's a little less confident in their active listening skills might be able to learn from the staff member who is more confident in their active listening skills. And this works just as well, if not better, by pairing up students who may be particularly advanced in terms of their ability to tolerate frustration or their organizational skills. We may want to pair them with someone who is less adept at those skills, pairing that person with someone who's more adept, so that the less skilled person is able to learn from the person who's kind of further developed their skills in this area. We want to ensure that we are monitoring students when they're peer modeling, so that if one child or adolescent became frustrated with another child or adolescent, we're there to provide the guidance and to guide that interaction so that it's a positive one. Stage 10 in trauma-informed educational practices refers to autonomy. So we want to build in as much autonomy as possible. When we think about trauma and how it can lead to a sense of loss of control of oneself, it's so important to restore that sense of control and to impart to students and children and adolescents that they can be autonomous. They can regain that sense of control over themselves. And one way to do that is to build in choices and ways to practice autonomy whenever possible. So choices can be made in various areas. There are choices in terms of which coping skills a child may want to utilize. That's one way to build in autonomy. We can build in choice in terms of projects that a child might want to complete wherever possible. I understand that there are certain assignments that are mandatory, but sometimes for special projects, we're able to build in the use of different mediums. For instance, whether a child wants to write a story or perhaps illustrate a story instead, things of that nature. And we can also build in choices in terms of activities to engage in throughout the day, or activities to engage in during recreational periods or break time. So we want to ensure that we are building in as much choice as possible so that a child can begin to foster a sense of autonomy and kind of regain control over their circumstances and their sense of self. So this can be quite empowering for children and adolescents who've experienced trauma. And unfortunately, sometimes we see a lessening in the provision of autonomy at home when children have experienced trauma, because rightfully so, parents are very protective and they want to ensure that their children are protected. And sometimes that leads into a loss of autonomy following a traumatic experience, because a parent may limit where a child or adolescent is allowed to go, who they're allowed to interact with. And so we want to ensure that we are building in as much autonomy as possible into their day in the educational setting. And we also want to encourage parents to find appropriate ways to rebuild their children or their adolescents' sense of autonomy following a traumatic experience. Stage 11 is extremely important in the provision of trauma-informed care as it relates to self-care for staff. So self-care for teachers, behavior technicians, counselors, guidance counselors, school psychologists, and administrators. Self-care refers to building in ways to take care of ourselves. So this can really be anything. Again, we want to take an individualized and strengths-based approach to the development of self-care for staff. So those of you who are athletic, playing tennis or racquetball or volleyball or jogging or exercising is a good form of self-care. Exercising is really a great form of self-care for anyone, even those of us, myself included, who are not particularly athletic, but fitness is an important aspect of self-care for all. Those of us who are artistic might enjoy aspects of self-care such as writing, drawing, painting. We may enjoy things like scrapbooking or other means of creativity. Socializing with friends or colleagues is an important aspect of self-care. It really can be anything depending on your own particular interests and means of enjoyment. So what I would suggest is that staff pair up, and I can provide forms or other suggestions for how to do this, but that you work in pairs and develop a self-care menu, if you will, for your partner. So take a few moments to learn about one another, learn about what your partner's interests are, things that they enjoy, or it can be new things that they would like to try as part of their self-care plan. And then it's helpful to type up a pretty document or write out a pretty document with different colored markers, if you will, but a menu of self-care options for your partner, and then provide them with that. Because we all know that self-care is important, but implementing that can be difficult at times due to multiple demands of life, such as work and family. So sometimes it's really helpful just to have that menu available so that when you're ready to implement a self-care strategy, you could just look at your menu and make an appropriate choice. So I would encourage you to all share your ideas with one another for self-care in an effort to generate more self-care options for all. Stage 12 in the provision of trauma-informed educational practices is just developing your proficiency in all of the areas that we have discussed. So I would suggest that you focus on one skill per week, and that you really try to practice that skill. You could practice with your own family members, you can practice with colleagues. So skills like validation, active listening, these are things that we should all be using in our everyday lives, and it will improve your communications, whether on a personal level or a professional level. I promise you that trying out some of these strategies will be beneficial for both you and your communication partner, whoever they may be. And then if there are specific skills that you're having difficulty with, I would encourage you to then focus on those skills, and practice them perhaps with a partner, or I can make myself available to you as well to review skills that you may be having problems with. So in conclusion, trauma-informed educational practices are not only beneficial for students who've experienced trauma, but they really are beneficial for all of our students. These practices can be utilized by staff, teachers, counselors, or administrators. Each interaction with a student should include the use of a trauma lens and trauma-informed approaches to communication. So by trauma-informed lens, what I mean is we want to move away from asking about a particular student, what is wrong with that student? We want to ask, what may have happened to that student to cause them to engage in a particular emotion, behavior or manifestation of emotion? We want to keep in mind that trauma-informed practices are mutually beneficial to create a respectful, adaptable environment for students, as well as educators and staff. So these strategies that we've talked about are beneficial to all and really help to foster a positive educational environment for students, teachers, staff, and anyone who may come into the educational setting. I want to thank you all for joining me today to learn about trauma-informed educational practices, and I hope that you all stay well and safe. Thank you so much for your time.